Hi, good morning, Cameroon. My name is Mihiraa. Let's start the warm-up session. Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your role play.
Hello, I'm Nurse Andrew Paulson. I see you've brought your child in today, and you look understandably worried. I want you to know we're here to help, and you absolutely did the right thing by coming in to get this checked out. To start, could you tell me what's been going on that led to your visit today?
Thank you, Nurse Andrew. It's my daughter. She's had a really sore throat and a fever for a couple of days now, but today, when she woke up, she had this awful rash all over her chest and back. It just didn't seem like a normal cold anymore.
I see. A new rash on top of a fever can certainly be worrying for any parent. Thank you for bringing her in. To make sure I have everything right, could I confirm your daughter's name and how you'd like me to address you?
Her name is Ashley, and you can call me Mihiraa.
Thank you, Mihiraa. To give the doctor the clearest picture, can you tell me more about the timeline of her fever and sore throat, and whether she's had any vomiting or abdominal pain?
Okay. The fever started 2 days ago, around 101 degrees Fahrenheit. She kept pointing to her throat and saying it hurt. And yes, her stomach has been a bit upset, and she did throw up once earlier today.
Thank you for sharing that. And have you noticed any physical effects, such as a rash, any changes in her urine output, or any swelling anywhere on her body?
Yes, this morning a rash popped up. It looks like a bad sunburn with tiny rough bumps. It feels like sandpaper. I also tried to look inside her mouth. Her tongue did look strange, kind of red with little bumps, like a strawberry. That was another thing that made me panic and come straight here. I haven't noticed any swelling, and she's been having little sips of water, but I haven't really checked her urine output. She just doesn't want to eat anything.
Thank you for sharing all of that, Mihiraa. You're providing excellent information. Based on what you've described, the next steps will be very straightforward. I'll start by doing a physical examination and taking her vital signs, her temperature, heart rate, and breathing, to see how she's doing right now. The doctor will then do their own assessment, and it's very likely they will want to perform a quick and painless throat swab to test for strep, as her symptoms line up with something called Scarlet Fever, which is basically a strep throat with a rash. The test gives us a result in just a few minutes. Do you have any questions or concerns about that plan?
Scarlet Fever? That sounds terrifying. How long is the wait? She's so miserable. I hate seeing her like this.
I completely understand that worry, Mihiraa. The name sounds much more frightening than it is today. I know sitting in an emergency department with a sick child is incredibly hard, and I'm sorry to say that the waiting time can be unpredictable because we must always prioritize the most critical patients first. I want to reassure you, though, that looking at Ashley, she appears stable. Her breathing is comfortable, and she's alert and responsive. While she clearly feels unwell, there is nothing to be alarmed about, and I can assure you she doesn't show any immediate danger signs. We'll be keeping an eye on her from here while you wait, and our team will be with her as soon as they can.
Okay, that's a bit reassuring. But can you provide some basic or preliminary care for her while she waits?
That's a great question, Mihiraa, and I'm glad you asked. Before I talk about what we can do now, can you tell me if you've already given her any medicine at home or tried anything else to help her feel better?
No, I haven't given her anything. I just rushed here.
That's completely fine, and you did the right thing by bringing her in first. While you wait, there are a few gentle things we can do together to help her feel more comfortable. I can bring an appropriate dose of children's paracetamol or ibuprofen from our medication supply to help settle her fever and ease that painful throat. This is one of the kindest things we can do for her right now. We can also keep her in light, loose clothing so her body doesn't get too warm, which helps the fever come down naturally. And perhaps most importantly, try to encourage her to take tiny, frequent sips of water. Even just a little bit now, and then we'll keep her mouth moist and her little body hydrated, especially if she hasn't been eating much.
Thank you, Nurse Andrew. I feel much safer now.
Good to hear, Mihiraa. Now to proceed, I need your verbal consent to start the physical examination and take Ashley's vital signs right here. This is just a standard check before the doctor sees her. Is that okay with you?
Yes, of course. Please go ahead.
Thank you, Mihiraa. Let me quickly summarize to make sure we're on the same page. We're here with 5-year-old Ashley, who has had 2 days of fever and sore throat, and today developed a sandpaper-like rash and a red, bumpy tongue. We've discussed that the next steps are a physical exam, vital signs, and a likely strep test to check for scarlet fever. We talked about starting comfort measures like fever medication and light clothing now, and you've given your consent for the examination.